Thank you very much. So this is not my work. This is the work of Joy Basu, who is unfortunately screened today, so she couldn't be with us. I'll try and be as brief as possible. But this, again, is an interesting piece of research because up till now, we've been trying to optimize a screening tool. We've been trying to prevent sudden cardiac death, but we haven't put much attention, at least from the cardiology perspective, in the quality of life of those individuals who get diagnosed with a condition. Again, that's an important aspect. Now, a bit of background. The fact is that we all know that exercise is good for us. And we know that exercise is the one single medication that is massively underutilized in every aspect of medicine, okay? We prefer to prescribe statins and aspirin rather than say to someone to go and do some regular exercise 3 or 5 times a week, okay? Now, we also know, on the other hand, as been said before, that individuals who have an underlying cardiac disease, if they put themselves under stress, the stress of exercise, they tend to be more likely to experience a malignant arrhythmia, sudden cardiac arrest. And that's the data from Domenico Corrado, who did that other study that Professor Sharma presented regarding the reduction of the incidence of sudden cardiac death. It's also worth highlighting that although Italians and Domenico Corrado discuss athletic individuals, we need to put it in context. They don't mean the Mo Farahs of this world, because in Italy, what you need to do is you need to go and get your stuff screened, even if you want to play for your local team, your local football club or cricket club. So a large proportion of those individuals are actually the people who are discussing and we try to save. Now, the other thing that we know for a fact is that this large database from Barry Maron in the United States has been going for a while, for about 20, 30 years, and it's been collecting data through newspapers, through the internet, through reports of insurance companies, have told us that actually hypertrophic cardiomyopathy is the single most common cause of sudden cardiac death in athletic individuals. And we've been working on this assumption for a long time. And essentially, every time we've got a patient with hypertrophic cardiomyopathy, and this is their tissue that Mary Shepard will be looking at with that myocardial disarray, what happens is they've got, apart from the myocardial disarray, they've got scar in their heart, they've got a very thick heart that needs more blood to sustain it. And if you put the stress of exercise, the concern is that that may result to malignant arrhythmia and a sudden cardiac arrest, okay? And that's the way we've been thinking for many, many years now. Now, what that has done, it has led to recommendations. So if you think about competitive athletes, these are the sports, the way we classify them, depending on the different components of exercise that are required. Essentially, you can't do anything, okay? Hopefully, thankfully, we live in the United Kingdom because they've got cricket there, billiards, curling, golf. We're not very good at riflery, I think. But, so there are some sports we can engage on competitive level. Now, actually, we've taken cricket out of there, so that's gone as well. But essentially, the point is that you're very, very limited, okay? And that's irrespective of how bad your hypertrophic cardiomyopathy is. So we are assuming that all hypertrophic cardiomyopathy is the same. Whether you've got a wall thickness of 30 compared to 10 millimeters, whether you've got lots of arrhythmia or no, everyone goes under the same banner. Now, there are recommendations for recreational sport, okay? I don't expect you to read that. If you're 0 to 1, means that it's not recommended. If you're 4 or 5, we're happy for you to do that. But even for recreational level, you will see that they recommend those low dynamic, low static sports. So again, bowling, golf, and skating, snorkeling, and some weightlifting, okay? So everything has been extremely restrictive. And the problem that this creates, and we've got evidence to support that, is twofold. One, the doctors that see you in clinic are worried about prescribing any exercise. So unfortunately, the people will not get the dreaded moment of a cardiologist, and can tell you that for free, is when the consultation comes to an end, the patient has received the diagnosis of hypertrophic cardiomyopathy, and they're thinking, is he going to ask me about exercise or not? Is he going to ask me about exercise or not? And the hope is that you will not ask him about exercise because he doesn't know what sort of advice to give you, okay? Or the other thing that happens is that they get the advice of do a bit of moderate exercise, and no one knows, not even the cardiologists know what that means, okay? So what has happened is that our HCM patients don't do exercise, and about 60% of them fail to meet even the minimum physical activity recommendations, which is below the non-HCM population. So what we've done, and that's where my heart group that Sabia mentioned earlier comes in, we went to look and see what's the size of the problem. In my heart group, we've got individuals that have been diagnosed with a condition, so we put all these questions to them, okay? So do you get any advice? Did you get any advice by your cardiologist when you were diagnosed with your condition? How specific was that advice? Was that helpful to you? Did it guide you as to how much you could do? And obviously the problem that we've got is that apart from the cardiologist, you may have the patient that is afraid to do any exercise because in his mind, everyone with hypertrophic cardiomyopathy is the football player that dropped dead during a football match, okay? Or the other aspect of the spectrum, particularly with teenagers and younger individuals, is that they may engage in the sort of exercise that actually is not particularly useful for their overall health, and it may be dangerous given the underlying condition. So a bit background, as I said, a bit more background. So the other problem that we've got is if you look at the young population with hypertrophic cardiomyopathy, it is increasing and it's going to increase more. Why is it going to increase more? Because hypertrophic cardiomyopathy, despite the fact of being a structural heart disease, the first abnormal size in the majority of cases is the abnormal ECG. Okay? So the ECG will raise suspicion of underlying hypertrophic cardiomyopathy, and the ECG is abnormal in up to 95% of patients who have that structural abnormality of their heart. So by screening more individuals with CRY, we're going to identify young people who are relatively asymptomatic, who have relatively mild disease potentially, and we're going to restrict them from doing any exercise if we continue the way we are now. Now, the other thing we know is that as we progress and research progresses, we've got a better understanding of the disease. We now know that HCM is by no means a death sentence. The majority of individuals diagnosed with HCM, they will live a full life and they'll go to their graves in their 80s and 90s for a completely different reason. And we also have better treatments to ensure that this happens. So essentially, the vast majority will have a normal lifespan, and with more screening, we're going to identify young individuals who are really keen to exercise, and we need to make sure that we don't convert them to couch potatoes, simply to protect them from hypertrophic cardiomyopathy while increasing the risk of developing common things like atherosclerosis or coronary artery disease in their 50s, 60s, or 70s. Now, as you've seen this slide so many times, I'm not going to mention it before. The point I'm trying to make is that actually we know now that hypertrophic cardiomyopathy is not as lethal as we previously thought from Barry Maron. It's not only our study by Mary Shepard's database, it's also studies in Australia, it's studies in US athletes that say that actually the normal postmortem and potentially the electrical faults tend to account for a greater proportion of sudden cardiac deaths compared to hypertrophic cardiomyopathy. And again, these 2 points are very important. They're very rarely mentioned in the literature, despite that they've been published for many years now. First point is that we know that athletes that we have evaluated who have hypertrophic cardiomyopathy in the exercise, they've got more efficient hearts. Okay? So because of the exercise, the heart seems to have better adaptation or less progression with the disease of hypertrophic cardiomyopathy. The second point is that there are some experimental studies in mice as usual, which say to us that if you put mice with hypertrophic cardiomyopathy and exercise on a regular basis, one, the disease may be retarded, or may even be some reversal depending on the age that the mice starts exercising, okay? So exercise seems to have a beneficial effect even in hypertrophic cardiomyopathy, and that shouldn't necessarily be surprising to everyone because how do we treat most patients with heart disease? We send them for cardiac rehabilitation. We try to encourage to do exercise, whether they've got ischemic heart disease or whether they've got congenital heart disease. So there is also a study, this is called the Reset HCM, where they try to test that, okay? So they took individuals with hypertrophic cardiomyopathy, mean age about 50, so they were not quite the young population that we were expecting, they were up to the 70s, 80s, okay? And they randomized them to some exercise program, so they gave them some exercise advice that they could do at home compared to regular treatment. And the point that they try to make is that if you do exercise in moderation, you like to improve your fitness, improve your quality of life, and at least in this particular study, admittedly, low numbers, and it's also important to keep that in mind. In order to prove safety with hypertrophic cardiomyopathy, you lose a huge amount of numbers, so it's always very challenging. So we need to keep that at the back of our mind. But anywho, they didn't see any more deaths or any significant increase in the arrhythmias in those exercising compared to those who had a more sedentary lifestyle. So what Joy did, she designed a study in order to do a structured, individually tailored, supervised exercise program for young individuals. And by young, we define them as 16 to a maximum age of 60. So our mean population cohort is going to be much lower than 50 years of age. In order to try and assess if this is possible, is it feasible within the NHS limits, and then assess the health, psychological and quality of life benefits of those individuals, and see if we get any bad signals regarding safety. Do they get more arrhythmias? Have we had any ICD discharges? Have we had any unfortunate sudden cardiac death during exercise? Now, this is a fairly complicated diagram, but I'll say 4 points. So what she's done is, she starts with a baseline investigation of individuals who are eligible for the study, okay? Those individuals will have anything from an ECG to a cardiac MRI. They will be very comprehensively investigated. And then what will happen is they will be randomized to an exercise group or a regular NHS service group, which means you don't get anything basically, okay? So we've got those two groups, randomization to the degree possible. They will go through a 12-week exercise program. That's 2 sessions per week that they come, and they have exercise for about an hour with a specialized instructor, and I'll explain a bit more about the program. And they will also get half an hour at the end of exercise, which is very important, of education, okay? Life with HCM, about ICDs, about different aspects of their life that patients are concerned when they've got hypertrophic cardiomyopathy. Then what happens once they're done with the program, both groups will be fully reassessed as we did in the beginning, and then we'll follow them up at 6 months' time to see if the potentially beneficial effect of exercise is sustained. Do those individuals continue to do some exercise once they have that very comprehensive and structured program? So, as I said, baseline investigations, extremely comprehensive. They get a consultation with a fitness instructor or a cardiac rehabilitation specialist in order to assess their fitness level, and that's how we'll adjust the program, because that's the point. Different people, particularly young people, like different things, different sorts of exercise, and they also come from different backgrounds. Someone may have never done exercise in their life, and you'll be surprised how many those are, compared to someone who's been exercising on a regular basis. The exercise and educational program, it's about 15 individuals, because we try to keep the ratio about 1 in 5 to ensure safety. We have different, as I said, programs for different levels of fitness, okay? And look at that, we get them up to 85% of the heart rate reserve. What that means is that we go to the level of moderate to intense exercise, okay? Because again, a younger individual is more likely to want to do a bit more rather than fairly moderate or mild form of exercise. So they do 1 hour of circuit exercises that are quite exciting. They do involve a lot of exercise. They do involve some music as well and dedicated programs. And they've got that color-coded program depending on their fitness level. They do that twice a week for 12 weeks. If they're going to miss a session, then they've got videos that they can look at in order to do the same program at home. Now, exercise, as I said, the educational program, again, participants provide with polar watches so they can measure and monitor the heart rate when they're exercising, either here or at home. Safety is paramount, so they've got ECG monitors on a frequent basis. They definitely have ECG monitors when they're exercising here, and will also do prolonged monitoring when they get up from a mild to moderate to a high intensity level, so when they change intensity level of exercise. And obviously they've got the opportunity to propose different topics for the educational aspect of the program. Now, these are the videos that I invite you to go and look at them. They're in YouTube, okay? So they've done an amazing job, about 30 different videos that patients can look at. They've done a very informative leaflet for the patients, okay? The team there, our fitness instructor, some of you may know Paula Simmons, for example, who is one of the CRY team and my heart team. You can see that there are different aspects that they explain what the heart is, what the exercise is all about, and they also provide, apart from the watches that we can download to see how much exercise they do at home, also with a patient diary. So what do we expect for that? Well, we hope that this will form the basis for exercise prescription in patients with hypertrophic cardiomyopathy. So we hope that in 3, 4, 5 years' time we'll be coming out with exercise recommendations at European international level that will give you an outline as to how a cardiologist can go about what does he need to assess in order to prescribe exercise and different form of exercise in patients diagnosed with hypertrophic cardiomyopathy. And the combination of individualized exercise prescription and weekly supervised exercise sessions could form the basis for a cardiac rehabilitation program in our NHS. Because going back to the point that if we are offering cardiac rehabilitation post-infarct in an 80-year-old individual, why shouldn't we offer a cardiac prehabilitation, if you want, or rehabilitation program to a 25-year-old individual who has been diagnosed with hypertrophic cardiomyopathy and is scared to death about exercise? And we're going to get much more benefit out of it as well. And hopefully it may form the basis for a multi-center trial. And I say that because also we can prove benefit with the numbers that we're able to get here, which we hope it's going to be 40 and 40, we'll never be able to conclusively prove safety of an exercise program that will need much bigger numbers. And what I'd like to say is a huge thank you. I know Heather is here, that she has also funded part of the program with cardiac risk in the young through the memorial fund that she created for her daughter Alex. Thank you very much, Heather.